The ICU that will prepare you best for CRNA school is an ICU that's high acuity. It is a common myth to believe that CV surgical ICU is somehow advantageous over other types because in every single hospital, it's going to look a little different. For example, if you're in a cardiac surgery ICU that's really high volume, there's a heart failure program, there's a transplant program, there's devices, your patients are on lots of drips, there's lots of fresh post-op hearts every day, you're gonna learn a ton about hemodynamics, invasive monitoring, vasoactive infusions, fluid and blood resuscitation, and so on. That's no doubt an amazing foundation for CRNA school. It's where I started and I loved it. At the same time, there are tons of cardiac surgery ICUs out there that only take one post-op heart a day. And unless you're the most senior person on the unit, you might not see one. You might find yourself managing patients with only one disease process. So your knowledge base, although it might be very good on that one topic, is not very broad. You can apply this same rule of thumb to any specialty. So how do you know if your unit is high acuity? Well, the first place to start is look at the size of the unit. Odds are if there's a lot of beds and a lot of patients flowing through, it's probably going to be higher acuity because you're going to see more and therefore you're more likely to see the sicker stuff. But the second clue is are 50% or more of the patients on some sort of support? So vasoactive infusions, ventilators, life support devices, and so on.